A new report from the BC Coroners Service says 126 children and teens under the age of 19 died from toxic drugs between 2019 and 2023. It says that makes unregulated drug toxicity the leading cause of unnatural death for the age group.
It is a terrible, terrible tragedy when youth die from a preventable cause.
The report released Tuesday shows that the number of kids dying from unregulated drug toxicity is increasing, with 13 deaths in 2019 compared to 28 last year. About 2/3 of those who died during the last 5 years were receiving or had previously received services through the Ministry of Children and Family Development, and about 2/3 had a mental health diagnosis or anecdotal evidence of a mental health disorder.
And I think that's salient. I think that shows where we are failing vulnerable children.
Many of us have been aware that the deaths have been adding up year after year after year. But to see it summarized this way is absolutely devastating.
A research scientist at the BC Centre on Substance Use says the fact that many of the young people who died had mental health issues and or received services from the BC government shows the issue needs to be addressed more holistically.
We have to think about how to support young people who are experiencing a lot of residential instability, family instability. They may have experienced quite violent disconnections from family, from place, from community, from friends as a result of government care involvement. And we've got to be supporting young people with their mental health.
About half of the kids and teens who died from toxic drugs from 2019 to 2023 were female, a contrast to adults, where males make up about 80% of drug deaths.
Where we're falling down on this is education, support for mental health, support for kids who are vulnerable.
BC declared a public health emergency because of overdose deaths 8 years ago. Since then, more than 14,000 people have died due to toxic drugs. In Vancouver, Monika Gul, City News.